Good. I'm good. How are you?
I'm doing fine. I'm doing fine. Thank you for taking the time out. I know that these are hectic times for you,
Yeah.
and I
Yeah.
know I know that you're super super busy, so I'm not going to try and keep you very long.
It's
But
okay.
some people do have questions, and I believe you have the answers. So hopefully you can make this happen,
I'm gonna
right?
try to. I am definitely going
Uh,
to try to. There's a lot of information to get out for
okay.
sure.
So let's see if we could use this format and get this information out. Thank you once again for thing. First let's start off. How are you dealing with this? How this
Yeah.
COVID-19?
Well, I am dealing with it as best as I can. I am a mom of five. I've got five kids
Wow.
here, trying
Yeah.
to do the homeschool thing, and keep them engaged and find work for them to do, searching websites to give them a curriculum. It's been a challenge. And also being a counselor, there's a lot of calls that come in and email requests, and we're working on a youth task force. So it's just been really busy. It's hard to manage. And I want to let everybody know up there, I'm feeling you, and it's hard, but we're going to get through this. We're all going to get through it. And being at home is the best place you can be right now.
So this is what it's important. You know, what are what's the update in Brampton about, going out and staying? I've seen a lot of parks trying to be locked down. You've taken
Yeah.
out basketball hoops out of parks. Is
Yeah.
what's going on?
We had to shut down our parks because what we're finding is that people were still gathering in these areas to play. And we have to be so careful. This virus is extremely serious. It spreads, and it spreads very easily. And so that contact, you don't might not even know you have it. And just say you're out there playing ball or playing at the park and somebody has it, the virus can stay on surfaces for up to a few hours, right? So
Mhm.
it's so easy to transmit, which is why we had to like seriously lock down our parks. We don't have the resources to manage if hundreds and hundreds of thousands of people. I'm sorry, I'm at home with my kids. Whoever's in the kitchen, can you turn off the water, please?
This is what work
Thank
is.
you.
This is what work is.
I gave everybody the direction. Do not come around this floor. It has to be very quiet.
There you go.
Um, so I'm sorry, listeners. But yeah, no, it's very easy to transmit, and we have to flatten the curve. We have to decrease the amount of people that get the virus, because if many people get it at once, the resources will be strapped. It'll be very difficult to manage.
So listen, we know Brampton downtown is almost a ghost town.
Yeah,
Businesses, small
yeah.
businesses are suffering.
Hmm.
Is there a plan? Is there a plan to save these business? Rent
Well,
is due.
yeah, it's hard. We have in Brampton, we've created task force, and we have an economic development task force where anybody who needs support, needs to brainstorm, strategize, figure out what to do during this time, get connected with all of those, government subsidies and plans. The best place to go is go to our city website and click the link that says Economic Development Task Force and get connected with the staff there. It's head by the head of economic development, and with two counselors on that team and a number of other very business minded people who know the system. There are different opportunities for people. You can apply for different relief funds and so on and so forth. So they have the best, most up to date information on that task force. So I want to encourage anyone who has a business, go to the City of Brampton website and click the link and get the support there.
So those are anybody who have a business. Now, can you speak to the workers that don't own the business,
Yeah.
that are possibly laid off, no
Mm-hmm.
job? What do they do?
Their best bet is to go to the EI office, or not go there, sorry, call them. I know that there's a backlog right now, and federal government is saying that they'll be able to give relief for May. But I want our residents to know that we made the decision as council to defer any late penalties or anything on property taxes for 5 months. So there's no pressure there by the city to make sure you pay your property taxes. And like I said, you have to, it's EI, and I know they're backlogged right now. We've never dealt with anything like this in our lifetime. So everyone is trying to figure out how to make this possible for everyone to get through it. And I really feel for all of you who are out there struggling. We have a social supports task force as well. So if you're in the need of food, if you're in the need of resources, go to the City of Brampton website and get on that. Click the link to get access to the social supports that are available there too. So, yeah.
You know, through your whole career, is this the hardest thing you've ever faced or dealt with? Is this through your whole career? I mean, you have made a pinnacle for all women, especially of color, to try and achieve in the position that you're in. I mean, I'm like in awe of that and just respect it so much where you've accomplished. And I think you've done an absolute fabulous job for your sector in Brampton. But now we have the pandemic where it's across the board and people are looking, who do we turn to? Who do we look for? We need facts, not fear. And the media, I know we possess a lot of fear. Now, homes are almost under pressure right now. Rent payments are due and stuff like that. Brampton is a booming city. Booming. It is like it's its own entity. What next? Where do we go from here?
You know, the only way to go when you're at the bottom is to go up, right? And you know what we do know now is that we've got a lot of work to do in making sure that our people are taken care of in these types of events. So I just want to say, like, you talk about my career, but this is my first year being in politics, right? Or first time being in politics. I worked in mental health services for a long time, almost 19, 20 years. And, you know, I've worked with many families. So the hardest things I have had to go through in my career is working with families who've gone through the worst of the worst crisis situations ever and have been in situations where, you know, they just feel hopeless. And my goal and my job is to empower people and give people hope. Now, I myself, I after baby number 5, I had a massive brain hemorrhage and I was in the hospital for a long time, and it was a challenging recovery. Doctors said I couldn't walk and I wasn't able to see, and I went through the whole ICU, and thank goodness to our doctors at Peel Memorial at William Ulster, with the little they have, they do a great job in trying to keep people safe and make those who are really sick very healthy. And I'm thankful because of what they did for me. I'm back on my feet. And I said, you know, when you've hit the bottom, you start to have a bit of fearlessness, right? Sometimes you're like, you know, why am I holding myself back from taking on opportunities? And that's essentially why I got into politics. I said, you know what, now's the time. I'm not going to hold back. I'm not going to sit and tell myself I can't. I'm just going to go for it. So I ran in the election and I won. And I just want people to know there's hope. You can do this. We're all going to get through it. And if you want the facts, your elected officials are there to give you the facts. And if you can't get a hold of them, that's a problem, right? So call your elected officials if you need that hardcore, I need this information now. In Brampton, we have had 2 teletown halls, and we're going to have another teletown hall on Wednesday. Now, I'm a co-chair of the youth task force. I really think of our young people because I'm sure all of you are going stir crazy. I have a 15-year-old and he's like, Mom, I just need to get outside. And I'm like, go outside, go for a walk. But please, you know, don't go and hang out in people's houses and come back, because you just don't know who the other people you're hanging out with where they've
Right.
been and how well they've washed their hands and how well they've sanitized themselves, right? And then you're going to come bring that into the house, and then who knows what can happen. So,
Right.
yeah, I just want to
Well,
say contact
how do
us
people
at the city.
how do people get on the town hall? How do people look to on the
Yeah.
town hall?
So on our website, city website, it's brampton.ca. Very easy. Brampton.ca is the website, and there will be links to the teletown hall and the information. If you follow my page at Char Mama 5, and it's CHARMOMOF number 5, I usually post when town halls are coming up and everything. So this Wednesday at 11, we're having a youth task force call. So everybody who's a youth, they want to get information. If you're an organization, you want to share information, that's a great chance to talk and hear information about the youth and where you can go to get support. Because I know there's young people on there who need access to Wi-Fi, who need laptops, who, need to still do some schooling and are trying to figure out, what am I going to do for the rest of the school year? Call into that youth task force phone call, and we'll be trying to get information from you and give information. And then you can also fill out our survey that we have on our youth task force
Okay.
website there at brampton.ca. So
Okay. What
lots of
about test
information.
centers? What about test centers? Getting tested if you feel,
Yes.
do we have that available in Brampton quicker than Toronto and stuff like that?
We have a test center in Brampton at Peel Memorial Hospital.
We do
If you're
right
over
now?
the Yeah, yeah, if you're over the age of 15, you were likely born there.
Okay.
And I
I
say
hear
15
you.
because my son was born at Peel Memorial Hospital. But yes, the at Peel Memorial Hospital, it's on Queen Street. That is a COVID-19 test center. But I want to encourage everyone, there are online checklists that you can get. And then I want to make sure that you guys have the right numbers.
Okay.
The telehealth number
Right.
is a good number to call. And you can also ask the question. They'll ask you questions on how you feel, and you'll be able to kind of figure out, are these the same symptoms. At the end of the day, if you're really concerned, go to the test center at Peel Memorial Hospital and get yourself
Okay.
checked out. Yeah,
Okay. So our test centers are up. Are
it
more
is up.
doctors needed? Are more doctors needed? Are more doctors coming?
That's a good question. We've heard that they have been calling or asking doctors and nurses to come out of retirement to help, but I'm really encouraging our province, and I sent a letter to Premier Ford and Health Minister Christine Elliott, saying that we have a large number of foreign trained Canadian qualified, which means they've gone through the tests, um, that are just sitting there waiting for a residency. And in order for you to get your practice to be a doctor, you have to go through residency. And only about 200 doctors who go through the testing have to go through are just sitting there waiting. I mean, sorry, around 200 doctors have to still are the ones that actually get the residency position. So there are upwards to 7,000 foreign trained Canadian qualified doctors in Canada, and just sitting on their hands. Everyone has a story of meeting a taxi driver who
Yeah, why are
has
they sitting
like
on their
some
hands?
serious credentials. They're a doctor, this and that. They should be
So
working. We should be saying,
what's going on? Why are they not? Why are we not allowing them to, if they're qualified doctors, why are we not allowing them to help in this time of thing? I think that we should be in advance of the states and watching what the states didn't do. Is that
mhm,
nothing that, the mayor, yourself, and other political
mhm.
leaders link? You don't talk about this? We don't discuss this?
Well, I that's why I sent the letter to Premier Ford and Christine Elliott. If look at what's happening in Italy right now, there are
Terrible.
it's terrible. And I'm telling you, have 4.1 doctors per thousand people in Italy. Canada has like 2.6 doctors per thousand people. If we were to get to a situation where our numbers go into the hundreds of thousands, we are going to be in serious trouble. So I'm saying we need more doctors now. Go online if you want to go to moredoctorsnow.com, sign my petition so that we can have more people saying to the government, a provincial government, make it possible to let these foreign trained Canadian qualified doctors work. Let them work now. Maybe there's something they can do, and they'll figure it out because they're really smart people, but there's something they can do to say, all right, since you've passed all your testing, all you need is a residency. I don't know, we'll put you in there now. Let's just get them working, because I'm really concerned, and I think a lot of residents, especially in Brampton, are really concerned about that too.
So, Council Lady, I would like to ask you a question, honestly, and I want you to look into yourself and think maybe before.
Okay.
We've seen the splurts across the world. We ourselves in Canada, which is, I was born here, love this country. We're getting splurts. Is it going to get worse before it gets better?
It will. It will. And that's why we are taking such drastic measures to keep people home. I think what's happened around the world is a very good indicator of what we could be faced with if we do not practice social distancing. If we do not take these extreme measures to encourage people to stay home, we are going to be faced with a serious, serious health crisis here in Ontario.
You know, I saw something today that almost looked like the blueprint that could have been what should have been. And San Francisco went on a total lockdown. Yeah. Total. Across the board. Is Brampton not powerful enough to set a trend across Canada? Do you not have the unity in the political forces to set a trend across Canada before this gets worse, to say, let's do a total lockdown? Are other political areas fighting something that I think you think about?
Yeah, I think we're all struggling with how far to take it. I think Brampton, we've been setting the bar pretty high on what to do. We're closing down our parks. We especially when it comes to the support and having the task force, the youth task force, the economic development task force, the social supports, and seniors. We have 4 task forces we're working on right now to make sure our people get information and are connected. Right now, I think San Francisco sets that bar high, and I really appreciate that high bar. And I think it's a good example that we should probably seriously consider. You know, the problem is, if you do a complete shutdown, lockdown, it's for how long, right? And we need to make sure that if we do a total lockdown, is everybody else going to do it too? Or are we going to do a total lockdown? And which we are, but we need to make sure that there's none of the coming ins and out, and, you know, that cross contamination. Because look at China right now. That's an example. China did the lockdown. Now they're starting to open up, and you're starting to see cases again. So
the cases are coming back, right?
They're going to come back. Right now, the goal is to have everyone shut down so that we can flatten the curve and buy us time to get a vaccine. We need a vaccine. This is not chickenpox. Once you get it once, you remember chickenpox, you get it once, you don't have to worry again. COVID-19, you get it once, you can get it twice. Right? So we need a vaccine, and we have to slow it down. But I want to encourage everyone, you know, I think there's a question about libraries on there.
Yeah.
Libraries and rec centers
will be open soon, and will they reopen soon? I can't see that happening.
Not right now. Nope. They're not going to reopen. I think we're just at the beginning of the COVID crisis here in Ontario, right? We're just at the beginning. You know, over in Europe, they're further along. So we see America is further along. We're in the beginning. So we have to shut down until we get the all clear from the WHO and from our doctors who are the professionals to say, I think we're good. Until we get that, everybody locked down.
You know, listen, listen, you're at a political level and talking to people who make decisions,
Hmm.
I think, for us, which
Yeah.
is, I guess, what happens. What's your time frame? What do you see this as? Like, I'm going to ask you
Yeah.
after what's going to happen after this, but what's your time frame? What do you guesstimate is a lockdown period?
Hmm.
Because I know we're not going to be no April 6th and 7th next week. We're ready to go back, or we should not be going back. Retail stores and stuff.
No.
What is your
It
what's going on up there in the political?
And you know what goes on in the political world is also what happens for everybody. I get information almost the same way, and you know, unfortunately, I think the thoughts that we're going to come back by Easter, or the kids are going to be back in school. I think people just need to expect the worst. Expect possibly a lockdown for the next 4 months. You know what I mean?
Four
Possibly,
months.
you know what I mean? Yeah, like this is the new norm until we have a vaccine. Until somebody says there's a vaccine out and they're able to mass produce it, you know, we're that's what we're really hoping for, just because of the nature of this virus. But I think I just want people to know that, you know, we are
Wow.
here. Yeah, I know it's scary. Come on
It's
now.
something
Like I
that
said,
it hits you.
it does. And I think um you know, it hit us too, when we kind of the realization. And I think when Ford said last week that kids probably won't go back to school to the end of April, it hit home for a lot of people as well. But you know, uh, the schools has already canceled prom, has already canceled graduation, and that happens June, right? May, June-ish.
Yeah,
So
yeah.
I think people might need to expect to have their kids home to the end of the school year. And so if that's the case, because we don't have camps and everything, um, start thinking about how am I going to keep my kids engaged and at, you know, during the summer, and what are we going to do, like what kind of backyard stuff I order on Amazon to, you know what I mean. I also
But
sorry.
I mean, you have stated, and I think it's the reality that you've stated 4 months. What is going to be your biggest problem of keeping kids, teens? I mean, adults, if they understand what's going on, you're going to have a big problem maintaining this 4 months
Yeah,
of inside. What's
it's
happening? What is it?
well,
Like,
you know, I think, and that's the thing, like, yeah, I'm going to put my mental health hat on, and I think when we work with people who deal with addictions and mental health, one of the main strategies for coping is going out and being social and exercising and sticking to a routine. So there's a few things we can definitely do. I don't know if you can kind of see my
yeah,
crazy routine that I have. I have half of it.
okay.
You know, get a routine for your kids and really follow it. You're gonna have to schedule yourself and your children to get up, get dressed, and you know, have breakfast, maybe even make them pack a lunch, you know, and go through a day as if you were going to school, because that routine can help with the sanity, that whole figuring out what to do next. If you have a routine, you know, you might be able to kind of keep things a little bit more contained. Even our young people, you know, there are some awesome apps out there that teach you how to get in shape. It might be time to pull out those P90X DVDs.
Yeah,
You
yeah.
know what I mean?
The
And
video
start
games
working
are,
out. You know, yeah, but
yeah.
you're gonna have to schedule yourself. You can go outside, go for a walk around your community and stuff, but we just want you to be careful, don't go onto the jungle gyms, and you can't walk around a grocery store and where there's a lot of people. Like you're gonna have to start finding more creative ways to keep active. But
is there
I
anything, is there anything that we could lead to bring morale up? Like, let's say I
mm,
set up my sound system on the street, and, you know,
yeah.
try to play some music outside. Will I
I
be
have to
hassled by
say,
police?
you know what? I have to say that the DJs that are going on Instagram and playing their sets, giving me life right now. The music is
Yeah.
good. So,
You know
I
what I
want
mean?
to encourage people to still do that, go play music. And that's a good question though. Like, we do have our noise bylaws, right?
You know what I mean?
But the people are, if you go online, people are finding some creative ways to even connect with friends. I saw one girl had a great um, birthday celebration where her friends drove by in cars wishing her happy birthday, and they kind of hung out in their garage. But you know what? Like, that's another thing. My husband right now is setting up a gym in the garage. That's what he's working on right now.
Okay.
And with the weights and everything, so that you could feel like you're still in a gym, but you know, you're still in
Yeah.
your house. I'm telling you guys, we're gonna get through this. We're gonna get through this. I'm telling you.
What's the hardest struggle for you to reach people? What's the hardest to keep them, you know, in tune, to stay inside? What's the hardest method for you that you have to reach them?
You know, I I think it's also those social media forums. Like, what is everybody using? I know I have a lot of residents that aren't on social media, so we try and get out newsletters and do print so people can read the information. Um, you know, I want to encourage people to get onto my Instagram, and that way you can see what's going on. Connect to the city of Brampton as well. City of Brampton has an Instagram page at City Brampton. There you go.
Mhm. Okay.
And just I want to encourage everybody to try and reach out and get connected. It's the best thing that you could do for your health and for your sanity, and what we can do to help keep you informed. I am really concerned though about those who suffer with mental health. I think we are going to see an increase in addictions, and those trying to find ways to cope. And so we have a lot of our mental health organizations are on high alert. If you need support with your young ones, go to the Where to Start website. That's through Peel Children's Center and Associated Youth Services of Peel. They have a really great website that has all of these different supports connected. There are a number of people who are now doing online parenting courses that you can access as well, which is good because I think this is a time when people are thinking, and business people are thinking, how do I launch into the social media realm? Now is the time to do it because everybody is going to be
Everybody's at
accessing social
home.
media. Everybody's at home, exactly.
Everybody's at
You
home.
know, and if you, I
Um,
apparently Amazon, I think might be looking to hire people as well. Like, so there are certain
think so.
places that do delivery that are looking for employees. So those who are looking for that opportunity, there's one there as well.
I'm going to bring you onto the street level, let's say. There's
Mm,
something I saw yesterday in a convenience store. Ran into a
yeah.
convenience store, did my social distancing. Saw on the counter the gentleman was selling one mask for
Mm,
$5.50. In a long time, I haven't been upset.
yeah.
So I told him, I looked at him and I said, you have masks here selling for $5.50, and we have doctors and nurses who need these masks. Why don't
Mm.
you donate it? His answer to me is, I should buy it and go give it to them. So,
Jeez,
yeah, I can't
if
tell
if
you
you
it was
weren't mad
said after
before, you
that.
probably got even more mad with that answer. Jeez.
So I can't, this is a family show, so
Yeah, yeah, for
what was said
sure.
after that was, whatever was said. But
Yeah.
walked out.
Oh, that's
What,
unfortunate,
what do you say? Are we not putting a strength on this, strap hold on this? Is Brampton not, what's it called, gouging of prices?
Yeah, price gouging is a problem. I know we saw Premier Ford talk about it very passionately with what one store was doing that with the Lysol or the Lysol wipes or something. Yeah, it's a problem, and we do have there are numbers that you can call as well about saying, you know, if you are experiencing being forced to go to work when you know that you shouldn't be, you can call public health. And if you're experiencing something like that and want to report get price gouging, definitely call public health and say, like, this is what I've seen. And they'll be able to do something with that information. You know, masks should be available to as many people as possible. And I don't know
Not at
what the
500.
I don't know what the going rate for a mask is right now, but you know, I
I
was
think,
impressed that I was able to get toilet paper for $4 at Shoppers Drug Mart. And
well,
I'm like, hey, it's
congratulations
on
to
sale. That's
Councillor
good.
Charmaine. I'm
Yeah,
telling you.
yeah.
So again, another thing about that, about this, everybody running all of a sudden for toilet paper, taking down everything in the
Hmm.
stores, grabbing all this. There's no,
Yeah.
is there a diarrhea problem I didn't hear about, or a pandemic of loss of food that I didn't hear about?
Yeah.
What do you have to address with that?
Oh, you know, but that's the nature of panic, right? And people are likely panicking and saying, I don't want to be without. The unfortunate thing with panic is, you know, you're thinking of yourself and not thinking about your fellow neighbor. And, you know, there were many seniors who need to get out and get certain supplies. Many of us who did not even expect to be in this situation now can't get Lysol wipes, can't get toilet paper. You know, you've got to think about everybody else. And, you know, I just don't want people to panic. There's always going to be these resources. And just give it some time, you know, and these stores will replenish. Like I said, I was able to get toilet paper and it was on sale, you know,
There you
and
go.
just follow the rules. I know there were some arguments in some stores. I was told I went to pick up 2 rolls of toilet packages of toilet paper and they said, you can't take 2, you have to take 1. I'm like, I have 5 kids. There's 7 people in my house.
Yeah,
But, you
yeah.
know, but I will put that one back because I guess it's true. You know, they want to make sure it stretches, right?
So
And yeah, so I
let,
think everybody, no need to panic. Think about those who still haven't gotten their supplies. And yeah,
let's look on the upside now.
yeah,
Finally, God spares our lives.
yeah.
He has mercy on us. He's a merciful God. We now find in, let's give you your 4 months. 4 months,
Hmm.
there's something has been found. I guess there's a way to
A
fight it.
vaccine. Yes.
Yeah,
All
I
right.
personally haven't taken a vaccine, but we'll discuss that, you know. My thing is this: where do you go now with you're behind 4 or 5 months of rent, payment
Mm,
is due, there's more stresses. How are you looking to get caught up? How are people to survive now?
right.
Is our government set in place for that?
Well, the federal government is working on, and if you go to the Service Canada website, there is a schedule of what people will receive and when they will likely receive it, what sort of reports are available. And we can send the link to you guys to put it up, or we can even put it up ourselves. Um, but I know the child tax benefit or the child benefit, that's going to start in May. A lot of people who are receiving EI, they'll get the for 575 based on their income, and once they get the applications in, that will start almost immediately, I believe. So people are going to start getting some financial supports within the next month or two. But I want to encourage everyone, if you still have those questions, call your local MP. Your local MP is the direct link to the federal government and they represent you. So they will be able to give you that information. And but if you want to do the search, go online and check it out because they are working on rolling out the supports for people as well. In Brampton, we are deferring late fees up to 5 months. So you don't have to worry about being had
What does
charged
that mean?
overages.
What does that mean exactly?
Hmm.
Deferring, Brampton is deferring for 5 months, but in five
Property.
months they owe that money.
Well, your property taxes, the property taxes pay for the city to run, right? And especially with this pandemic, right? We have to still cover the cost of keeping the roads clear and maintaining and doing the things that are important. Plus, because we've closed all the recreation centers, all of our revenue that we would get from people paying for their camps, their gym memberships, there's so many different revenues and things that people would pay into the city. We're not going to get that. So we can't just say, guys, don't worry about paying your taxes. You don't have to pay it. We're going to decrease it. We still have
Not
to
even
run the
for a month.
city.
Not even for a month.
But
We
but
can't feed
just
the
rest
people for a
assured,
month.
just rest assured though that if you can't pay your property tax, you won't be there won't be any you won't be penalized for not paying. You won't have any additional charges for late fees or anything like that. So that's what we're trying to do. There's no late fees. Plus, our buses are free as well. So if
Okay.
anybody needs to get around the city, they have to. You will not be paying to use our transit system as well. So that's something
Okay.
else that we've done.
Okay.
Yeah,
You're.
just just call into the city. We're here for you guys. We're here to help. I
Well,
still
I
have to
mean,
pay my taxes too. We're all in this. We all
I know
gotta
you
get
say
through this.
call in. I know you say call in, but I feel like it's like my phone company. I get a machine more than I get a person, and it gets
Really?
frustrating. Yeah,
Yeah,
my phone
yeah.
company. I don't know about yours, but mine. I don't
Yeah.
want to say the name on
No, no,
it,
I
but
mean that the city.
it,
Yeah, I
it it's
understand.
like it's always about machines, machines, machines.
Hmm.
When is it that answers are going to be answered by an actual person, like yourself and
Hmm.
stuff like that? It's like your constituent, right?
Hmm.
Do they call you or they call your office? Because you're going to get backlogged now,
Oh,
and people need
that's never
answers.
stopped. That's never stopped. We've always My number has always been there for people to call 905-874-2671. You can send me an email at charmaine.williams@brampton.ca. You can also call 311. 311 is a great source and they do answer the phone. You don't get voicemail. You call
Okay.
311 and you will speak to a live person. And if you say, I need to connect with Councillor Williams, 311 will put it in a note and it comes to us. Like, I get it. I get the
Okay.
email, I get the call. So, and my staff are awesome. They will follow up with you and we'll do our best. It's been pretty hairy. Gets pretty busy sometimes, but we will be following up with you as best as we can. And if you don't hear from us, send another email and say, "May I hear from you?" Or I haven't, or I haven't heard from you, Councillor Williams. I'm waiting for a response. We will get on it.
I have
We will
one
get on it.
final question, but before my final question, before we get out of here, I really, really want to connect with you again because I have so much other questions about policing,
Yeah.
immigration, culture. These are the things that I hope to be discussing, but this pandemic suits all of
Yeah.
Trump
Yeah.
everything. Sorry for the word,
Mm-hmm.
but
It
um,
does trump everything, but
it
it's
does
true.
trump everything. And I think it's best that people know in Brampton, especially how concerned. Well, I know you are because you've taken yourself to the street
Mm-hmm.
level as well as the political level. So I
Yeah.
hope other counselors and they maybe can address their people a little bit stronger. I
Mm-hmm.
think that's something that needs to be worked on. I
Mm-hmm.
think that we don't get to talk to anybody unless it's election time.
Mm-hmm.
So, and
Yeah.
that's really disturbing to me. I hope that changes, and I hope you can
Mm-hmm.
make that, set forth that change because you do a lot of things different. So I appreciate you for that.
Thank you. Thanks. And I want to let everyone know that I'm here to help. It's a hard time. We're gonna get through this. And just remember, at Charmama5, you can send me a message. You can email me, charmaine.williams@brampton.ca, or you can give me a call, 905-874-2671. We're here. We're here for help, to support with anything. And if I don't know the answer, I will find you the answer. I definitely
I
will.
think you just answered my question, because my question was pretty much your advice for the people, and I think that you pretty much answered it there, to be able to contact you, be able to get thing. And I'm sure that anybody in Peel listening and tuning in now that contacts you, you could direct them to the right person,
Absolutely. That's
right?
right. And if you go to brampton.ca, there's so much information there on the COVID-19 pandemic, where to go, the 4 task force. We have the social supports, economic development, seniors, and the youth. The youth is the one that I'm on. And we're going to
Okay.
have a call at 11 a.m. on Wednesday morning. And then there will be a teletown hall with the mayor, with everybody, happening around 5:30 that night. So
Okay.
there are ways to tune in, and check my Facebook page or my Insta page, and you'll
And
get the
I'll be
information.
connecting with you because, you know, Keep Six, we charitable, we're charity, and we're going to connect
Yes.
with you a little bit more about stuff, and talk to you about that. But Council Lady, I love you. Thank you. Appreciate
Thank
all
you
that
so
you
much
do.
for having me. Thank
Not
you
a
so
problem.
much. And I'm amazed. No, we didn't have any other distractions except for that one in the
God is
beginning.
good. God is good.
That's
God is
right.
good. I hope to connect with you hopefully in a month, maybe in an update, you
Okay.
know, and see what's going on. Correct?
Yes, for sure. Yeah, absolutely. And
All
check
right.
in often, guys. Like, I have no problem with talking and connecting with you guys, because there is information there. Again, 311. And if you need telehealth, you can go to the Peel region. Please stay inside. Social distancing is the only way we're going to be able to flatten the curve. We're going to have a decrease in the amount of cases.
Come down the
Social
yard.
distance. Stay in your yard and listen to the DJs, them like DJ Wiz, please.
Thank you. Thank you.
Thank
Bye
you
bye.
so much, guys. Bye now.